So what we're going to try to do is demonstrate another method for setting a hip that Dr. Hill still talked about. This is with the patient on a table. He does talk about putting the lame leg against the wall, probably attempting to use the wall to control some of the auxiliary movements. So really what I'm going to do is try to show you how this is similar to his description of what he does in supine. However, the problem is, even if the patient's against the wall, you can still pull them around on the chair, so your ability to really get into the hip is minimal because there's too much movement happening. So what he does talk about is basically creating a lot of hip and knee flexion, hand at the trochanter, and then trying to pull. So first, depending on the height of the table and everything, I'm going to get really hunched up. So I'm going to lift here, have the hand on the trochanter, and use my torso, right? So really come up here, but you can see that she's moving. So even if she was against the wall, she'd move a lot because I can do this. So if I'm not careful, then this, I tip her away, and I do that, and I twist her whole pelvis on the table. So the problem is, even if she's against the wall, I'm still going to get all that auxiliary movement. That's essentially what Dr. Still was trying to talk about in research and practice. The problem is there's very low control because I can't control her with my torso. The table's not controlling her. Even if she was against the wall, I'd still pull her off axis a lot and create a lot of auxiliary movement. So it's not as useful a method as one would hope.